Course Introduction. Psychological disorders. You must have observed that people often label behavior as mad, crazy, or insane if the behavior deviates from the prevailing societal norms. You must be curious to know about such aspects of human behavior. We are all intrigued and want to know the answers of why people indulge in violent behavior, drugs, or sexually perverted behavior and such other abnormal patterns of behavior. From ancient to the present times, the criteria to diagnose mental disorder has also witnessed many changes. Mental illness as a non-communicable diseases, NCD, is a major burden on health and well-being. Initially, NCD included the Big Four, namely, cardiovascular diseases, type 2 diabetes, cancer and chronic respiratory diseases. Later on, mental health was included under the umbrella of NCD. According to World Health Organization, WHO, no health without mental health, thus, emphasized on the awareness and promotion of mental health and prevention of mental illness. The Sustainable Development Goals 3 Sudanese pounds, of WHO, out of 17 Sudanese pounds, focuses on physical, mental and social well-being for all at all ages. The importance of mental health has been recognized globally. Presently, the countries are committed in the prevention and treatment of non-communicable diseases including behavioral, developmental, neurocognitive disorders, which constitute a major challenge for sustainable development, SDG, WHO. The course on psychological disorders will provide you an overview of mental disorders that come under the domain of abnormal psychology. The study of mental health problems is also known as psychopathology. The course highlights the nature of psychological disorders, classification criteria, with its history and scientific underpinnings. Each unit includes the clinical picture, causal factors, and treatment of a particular disorder being discussed. How the disorders are maintained, and what effect they have on people's lives is also presented. The course content also includes case studies and examples so as to develop an understanding of disorders. Block Introduction. There are 4 blocks in this course. Block 1 covers psychological disorders, the classification criteria and primarily the anxiety disorders according to DSM-5 criteria. Block 2 focuses on mood disorders, various forms of psychoses, somatic symptoms disorders and eating disorders. Block 3 explains personality disorders as categorized under Cluster A, B and C, followed by paraphilic disorders and substance use disorders as defined by DSM-5. Disorders related to children and adolescents, disorders related to trauma and stressors and neurocognitive disorders are discussed in Block 4. Now let us see the content as covered in each block. Block 1 introduces you to psychological disorders and anxiety disorders. Unit 1 explains the history of psychological disorders, its classification criteria and causal factors. The models to explain psychopathology and ethical concerns are also discussed in the unit. Unit 2 and Unit 3 cover disorders of anxiety, fear, and obsessions. It also explains the distinction between panic, fear, and anxiety. The diagnostic criteria, causal factors and treatment of related disorders according to DSM-5 are discussed. Block 2 consists of 4 units. Unit 4 focuses on mood disorders. The types of unipolar and bipolar disorders are explained in this unit. Their causal factors, prevalence and treatment are also discussed. The unit also covers suicide and suicidal ideation. Unit 5 gives a description on schizophrenia spectrum disorders. The unit presents an overview of positive and negative symptoms, types of psychotic disorders, biological, psychological and socio-cultural causes of the disorder. The unit also briefly discusses the treatment of psychosis. Unit 6 highlights somatic symptoms and related disorders. The clinical picture, causal factors and treatment of illness. Anxiety disorder, factitious disorder and conversion disorder are discussed. Distinction between conversion disorder, factitious disorder and malingering, faking is also explained. Unit 7 introduces eating disorders, namely bulimia nervosa and anorexia nervosa. Their clinical features, probable causes and treatment options are discussed. Block 3 consists of 4 units. Unit 8 introduces you to an important group of disorders, namely personality disorders. In this unit, Cluster A, schizoid, paranoid and schizotypal personality disorders are discussed with their clinical features, causes and treatment. In a similar way, in Unit 9, Cluster B and C personality disorders are explained. Unit 10 introduces to the paraphilic disorders and sexual dysfunctions. Concepts like normal sexuality, gender differences in sexuality, and sexual response cycle are explained. The sexual disorders and dysfunctions as mentioned in DSM-5 have been discussed. We then move to discuss their etiology and treatment modalities. An overview of gender dysphoria and transsexualism is also presented. Unit 11 explains substance use and related disorders. The changes in the classification from DSM-IV are also discussed. The unit explains the differences between substance use, abuse and dependency. Explanation of etiology and the physical and psychological effects of substance use disorders are addressed. Gambling disorder, a recent entry in DSM-5, has also been discussed briefly. Block 4 consists of 4 units. Unit 12 and Unit 13 give a description of childhood and adolescent psychological disorders. Developmental psychopathology is discussed in Unit 12. The main disorders described are childhood depression, oppositional defiant disorder, conduct disorder and attention deficit, hyperactivity disorders. Neurodevelopmental disorders like intellectual disability, autism spectrum disorder and specific learning disorders are discussed in Unit 13. Unit 14 discusses the nature of neurocognitive disorders. Major neurocognitive disorders, delirium and amnestic disorders are explained. The unit also covers the causal factors and treatment of neurocognitive disorders. Lastly, Unit 15 will introduce you to trauma and stressor-related disorders. The unit will explain the concepts of stress, stressors, and association of stress to mental and physical health. Disorders like adjustment disorder, acute stress disorder, and post-traumatic stress disorder will be discussed. The unit will also highlight the significance and objectives of crisis intervention for trauma-related disorders. Block 1 Introduction to Psychological Disorders.
दोस्तों BPCC 133 यानी कि साइकोलॉजिकल डिसऑर्डर्स के बारे में रीड आउट का जो मेन इंट्रोडक्शन पार्ट का वीडियो आपने अभी देखा। इस वीडियो में जो कुछ भी टॉपिक इस किताब में दिस बुक हैज़ दिस बुक हैज़ different topics, right? So everything is been told briefly, so you know what you should expect in the entire book. Basically, this is an IGNOU course in which there is a subject. The subject name of the subject is psychological disorders. Hopefully you are benefiting from this readout. I would like to request you to give a thumbs up and also subscribe to the channel. Thank you.